Understanding stroke, a sudden disruption. A stroke occurs when the blood supply to a part of the brain is interrupted. This interruption prevents brain tissue from receiving oxygen and nutrients. Without these essential elements, brain cells begin to die within minutes. Strokes manifest in different ways. An ischemic stroke, the most common type, happens when a blood clot blocks an artery supplying blood to the brain. A hemorrhagic stroke occurs when a blood vessel in the brain bursts, leaking blood into surrounding tissues. Finally, a transient ischemic attack, often called a mini-stroke, is a temporary blockage of blood flow to the brain. The effects of a stroke can be devastating. They often lead to long-term disabilities, impacting a person's ability to move, speak, and think clearly. The impact of stroke extends beyond the individual. Families grapple with the emotional and practical challenges of caring for a loved one recovering from a stroke. Strokes are a global health concern. Millions of people worldwide experience strokes each year. Understanding the nature of strokes and the importance of timely intervention is crucial in reducing their impact. After a stroke, the brain embarks on a remarkable journey of recovery. This process, known as neuroplasticity, highlights the brain's ability to reorganize itself. Neuroplasticity allows healthy areas of the brain to compensate for damaged regions. It's a process of rewiring and forming new connections between neurons. This remarkable adaptability forms the foundation of stroke rehabilitation. The extent of recovery varies from person to person. Factors influencing recovery include the severity of the stroke, the area of the brain affected, and the individual's age and overall health. Time plays a crucial role in stroke recovery. The most significant improvements typically occur within the first few months after a stroke. However, recovery is an ongoing process, and individuals can continue to make progress even years later. Stroke rehabilitation is a comprehensive process designed to help individuals regain lost skills and function. The primary goal is to maximize independence and improve quality of life. Rehabilitation focuses on restoring physical abilities. Therapists work with patients to regain mobility, improve coordination, and enhance muscle strength. The ability to perform daily tasks, such as dressing, bathing, and eating, is a key focus. Cognitive skills are also addressed in rehabilitation. Therapists help individuals improve memory, attention, and problem-solving ability. Communication skills, including speech and language therapy, are vital components of the recovery process. Throughout rehabilitation, the emotional well-being of stroke survivors and their families is paramount. Support groups and counseling provide a safe space for individuals to share their experiences and navigate the emotional challenges of stroke recovery. Stroke rehabilitation is not a solitary journey. It requires a collaborative effort from a team of healthcare professionals, each with specialized expertise. Neurologists, physicians specializing in brain disorders, play a central role in overseeing medical management. They diagnose the stroke, manage medications, and address any underlying medical conditions. Physical therapists focus on improving mobility, strength, and coordination. They guide patients through exercises tailored to their specific needs and help them relearn movement patterns. Occupational therapists help individuals regain the ability to perform everyday tasks. They assess home environments, recommend adaptive equipment, and teach patients strategies to manage daily activities. Speech-language pathologists address communication and swallowing difficulties. They work with patients to improve speech clarity, language comprehension, and safe swallowing techniques. Nurses provide round-the-clock care, monitoring vital signs, administering medications, and assisting with daily living activities. Psychologists offer emotional support, counseling, and coping strategies for patients and their families. Section 5. Phases of healing, a journey back to independence. Stroke rehabilitation is a dynamic process that unfolds in phases, each with specific goals and interventions. The acute phase begins immediately after the stroke. The focus is on stabilizing the individual's medical condition and preventing further complications. Medications may be administered to dissolve blood clots or control bleeding. The subacute phase, typically starting a few days after the stroke, marks the beginning of intensive rehabilitation. Therapists work closely with patients to address physical, cognitive, and communication impairments. The chronic phase of rehabilitation represents the long-term journey of recovery. Individuals continue to work on regaining function, adapting to any remaining disabilities, and reintegrating into their communities. Throughout these phases, the emphasis gradually shifts from restoring lost functions to adapting to limitations and maximizing independence. The journey of stroke rehabilitation is a testament to the resilience of the human spirit and the power of specialized care. Section 6. Tools and Techniques. Empowering Recovery. Stroke rehabilitation employs a diverse range of tools and techniques to facilitate recovery. These interventions are tailored to each individual's specific needs and goals. Physical therapy often incorporates exercises to improve strength, flexibility, and balance. Therapists may use assistive devices such as walkers or canes to help patients regain mobility. Constraint-induced therapy, which involves restraining the unaffected limb to encourage use of the affected limb, can be particularly effective in promoting motor recovery. Occupational therapy focuses on improving daily living skills. Therapists may recommend adaptive equipment such as specialized utensils or dressing aids to enhance independence. Home modifications, such as grab bars in bathrooms or ramps for wheelchair access, create a safer and more accessible living environment. Speech and language therapy addresses communication and swallowing difficulties. Therapists use various techniques, including articulation exercises, language drills, and swallowing strategies to improve communication and ensure safe eating. Cognitive rehabilitation focuses on improving memory, attention, and problem-solving abilities. Therapists use computer-based programs, puzzles, and other engaging activities to challenge cognitive skills and promote brain plasticity. Section 7. The cutting-edge innovations in stroke rehabilitation. The field of stroke rehabilitation is constantly evolving, with innovative technologies and approaches emerging to enhance recovery and improve outcomes. Robotic-assisted therapy utilizes robotic devices to assist with repetitive movements, providing intensive and precise training. These devices can target specific muscle groups and provide feedback on performance, optimizing motor learning. Virtual reality technology creates immersive and engaging environments for rehabilitation. Patients can participate in virtual activities, such as reaching for objects or navigating obstacles, which challenge their physical and cognitive abilities in a safe and controlled setting. Brain-computer interfaces establish a direct communication pathway between the brain and external devices. BCIs hold promise for individuals with severe paralysis, allowing them to control prosthetic limbs or communicate through thought alone. Non-invasive brain stimulation techniques such as transcranial magnetic stimulation and transcranial direct current stimulation are being explored as potential tools to enhance neuroplasticity and promote recovery. These techniques involve delivering mild electrical or magnetic pulses to specific areas of the brain. Tele-rehabilitation, the delivery of rehabilitation services remotely using technology, is gaining traction, particularly in underserved areas. Patients can access therapy sessions, monitor their progress, and communicate with their healthcare providers from the comfort of their homes. Section 8. A personalized approach, patient-centered care. At the heart of effective stroke rehabilitation lies a patient-centered approach. This approach recognizes that each individual's stroke journey is unique. with specific needs, goals, and preferences. Treatment plans are tailored to the individual, taking into account their physical abilities, cognitive strengths, personal interests, and support systems. Open communication between the patient, their family, and the rehabilitation team is crucial throughout the recovery process. Setting realistic goals is essential for maintaining motivation and celebrating progress. Small, achievable milestones pave the way for larger goals, fostering a sense of accomplishment and hope. Cultural sensitivity and awareness are paramount in providing culturally competent care. Therapists strive to understand and respect the cultural beliefs, values, and practices of their patients, adapting interventions and communication styles accordingly. Section 9. Preventing another stroke, a shared responsibility. Preventing another stroke is crucial for individuals who have experienced a stroke. By adopting healthy lifestyle habits and adhering to medical recommendations, individuals can significantly reduce their risk of recurrence. Lifestyle modifications play a vital role in stroke prevention. Quitting smoking, maintaining a healthy weight, and engaging in regular physical activity are essential steps towards a healthier heart and brain. Managing underlying medical conditions, such as high blood pressure, diabetes, and high cholesterol, is critical in reducing stroke risk. Adhering to prescribed medications, attending regular checkups, and following a doctor's recommendations are essential components of stroke prevention. Stroke prevention is a shared responsibility between individuals and their healthcare providers. By working together, individuals can take proactive steps to protect their brain health and reduce their risk of experiencing another stroke.